Hello, everyone, and welcome to Chapter 5 of Flight Physiology and Human Factors. In this chapter, we are going to look at a concept that is fairly similar to what we looked at in the last chapter with hypoxia, oxygen, and hyperventilation. So, in this chapter, we are going to continue to look at gases in the body. We're going to look at trapped and evolved gases. So our chapter objectives here are number one, to understand the physical relationship between the solubility of gases in the body and the pressure around the body. So we will talk about that. Number two, we want to identify the signs and symptoms of decompression sickness and how they are caused by trapped or evolved gases in the body. And finally, we want to be able to identify the anatomical structures in the body that tend to collect trapped gases and how they relate to the different phases of flight, the severity of the different symptoms that show up, and the different mechanisms that are in place to clear excess gas out of the body when those gases build up. So our last chapter focused on hypoxia, which was basically referring to the body or different tissues or different organs in the body receiving a substandard amount of oxygen, meaning that those tissues and those cells and those organs are not able to meet their high energy demands because they're not receiving enough oxygen. So what we're going to see here is that hypoxia is not the only adverse physiological phenomenon that we can associate with high altitude. Now, with hypoxia, what we saw is that at high altitude, the low partial pressure of oxygen causes us to not pull in enough oxygen in order to meet our tissue's metabolic demands. Now, decompression sickness, or DCS, is going to be a high altitude phenomenon, but it doesn't have the same exact physiological underpinnings. So DCS is associated with the evolving or creation of gases in the body due to those gases bubbling up out of body fluids like your blood due to the low pressure environment that you find with high altitude. So we are going to see that many of the signs and symptoms of DCS are shared in common with hypoxia, apart from some other things that are unique to DCS, things like joint pain, middle ear discomfort, GI tract issues, toothaches, and things like that. So the first thing we want to look at is the scientific explanation of the relationship between gas solubility and the pressure. So again, we're looking at this relationship between gases like oxygen, nitrogen, carbon dioxide, the air we breathe, and the pressure that we find those things at. And of course, we've seen before that pressure is dependent on the altitude that you are at currently, okay? So your textbook comes up with a really good example of this. So your textbook mentions the classic case of carbonated beverages. So the whole idea of a carbonated beverage is that it is contained within a sealed canister container, and the gas inside is kept soluble in solution, meaning that the gas molecules are actually a part of the liquid drink. They are not in their gaseous form, they are in a liquid form. And the way that we maintain that is we keep the beverages stored at low temperature, we keep the drinks cold, and we keep the beverage at high pressure. So once you open a can of beer or of soda or of something else, you are releasing that pressure into the environment. And the only thing really keeping the drink strong at that point, keeping the drink fizzy, is the low temperature. But the longer you keep that drink open, the more of that gas, which is a part of the liquid part of the drink, the more of that gas is going to start evolving out of solution, turning it into its gaseous state and escaping the container. So the longer you leave a drink like that open, the more flat it is going to get. The less gas is actually going to be a part of the container. So gases like carbon dioxide for your beverages, or oxygen or nitrogen, which we know all three of those things are in the air that we breathe, these gases are most soluble in liquid, things like your blood or your other bodily fluids, when the temperature is low and the pressure is high. So what I am showing you here is what is called a phase diagram. This is something you would usually only see in a chemistry class, but I think it is appropriate to show you guys here. So basically what this is showing us is that on the x-axis we have the temperature of the gas or of the substance that we're dealing with. In this case, we're dealing with carbon dioxide. And then on the y-axis, we're looking at the pressure that we are exerting on that substance. Again, carbon dioxide here. So at a low pressure and a high temperature, carbon dioxide is going to be a gas, okay? So from all low pressures or at all temperatures at low pressure, carbon dioxide is going to be a gas. So basically what you can take away from that is that at any low pressure, carbon dioxide is most likely going to be a gas unless you get the temperature very, 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 very cold. But at room temperature, which is about maybe about 15 degrees Celsius, and then at standard atmospheric pressure, which is 1 atmosphere, carbon dioxide is going to be a gas. Okay, so if we want carbon dioxide to dissolve into a liquid like your beer or your soda, we want to move the phase diagram for carbon dioxide. We want to end up in this quadrant right here, the liquid quadrant. So in order to do that, we need to do two things. So if we start here, we need to decrease the temperature to go this way, and then we need to increase the pressure to go up this way. So again, what this is telling us is that any gas, whether it's carbon dioxide or nitrogen or oxygen or whatever, any gas is going to be at its most soluble when it is maintained at high pressure, okay? So this brings us to a new gas law that we need to discuss, which is Henry's law of gas solubility. And this basically states that exactly what we just saw. Henry's law tells us that the amount of gas dissolved in a liquid solution is proportional to the pressure of the gas over the solution. So if you increase the pressure of a gas, essentially what you are going to do is provide a downward pushing force that is going to push these gas molecules that are floating over the liquid suspension and push those gas molecules to actually become a part of that liquid solution. So if we increase the ambient air pressure, then we start to force the gas around us into a liquid state. So if you consider a body fluid like your blood naturally contains dissolved gases like oxygen and nitrogen and carbon dioxide. So it doesn't contain a whole lot of these gases, but a little bit is there because of the pressure pushing down on them. So the question then becomes, if we are used to being exposed to an ambient air pressure of at sea level 760 millimeters mercury, or a little over 1,000 or a little over 1 bar, or whatever units you want to use, if we are used to the ambient air pressure at sea level or near sea level, and then suddenly we get in an airplane and we ascend to about 28,000 feet cruising altitude, what is going to happen to those gases, according to Henry's law, when we are now being exposed to a much lower ambient air pressure? That is a fundamental thing that we saw in the last chapter, is that when you climb in altitude, the air pressure around you is going to plummet logarithmically. So if the pressure goes down, our natural conclusion is going to be that if the pressure goes down all around us, then those gases that are dissolved in our body, in our different fluids, those gases are going to become less soluble, and they are going to start bubbling out of solution and forming gas bubbles, which you can imagine are going to be problematic. So let's look at something that is related to altitude decompression sickness, a slightly different kind of decompression sickness that is actually associated with deep sea diving. So we've seen that if climbing altitude above sea level decreases your ambient pressure, then diving below sea level is similarly going to increase it. And this is something that deep sea divers deal with. So deep sea divers that submerge to low depths will increase the solubility of things like nitrogen in their blood temporarily. So they are experiencing a greater amount of pressure of downward pushing forces all around them. And this is going to push extra nitrogen that they are breathing from their air tank. That extra nitrogen that they're breathing is going to get pushed into a liquid form in their blood and in their different bodily fluids, okay? So to understand why we're talking about nitrogen here rather than something like oxygen, breathing 100% oxygen is really only something that you're going to do in emergency situations. So you're only going to really do that if you are at risk for something like hypoxia, okay? So otherwise, you're going to be breathing regular compressed air. So we understand that the air that we normally breathe is 78% nitrogen. So just on the basis of abundance, we are going to see that because most of the air that we breathe is nitrogen, nitrogen ends up being kind of the problematic gas for us in decompression sickness, okay? So things like oxygen and carbon dioxide and argon will also bubble and evolve out of solution, but because nitrogen is so much more abundant than all of those other gases, it's going to be the one that we tend to focus on here. So another issue with nitrogen, if we compare it to something like oxygen, is that oxygen, we understand from the last chapter, gets metabolized by the cells of our body. So we need to breathe oxygen so that we can deliver that oxygen to the cells and tissues of organs of our body. And those cells will actually use the oxygen and metabolize it into something else. So that oxygen basically disappears once it gets delivered to the cells. Nitrogen is not like that. Nitrogen is not really used by the cells of the body for anything at all. So all nitrogen is really going to do is just get kind of stuck in different parts of your body. It gets stuck in your blood, it gets stuck in your body fat, it gets stuck in your skin and in your muscles. So nitrogen is basically dissolved in the different fluids that are all throughout your body. So the issue again here with deep sea divers is that they're submerging to deep levels in the ocean. That is going to increase the pressure all around them and force that nitrogen that they're breathing from their air tank, force that nitrogen into solution all throughout their body. And the issue becomes that if these deep sea divers return to the surface too quickly, they come back to regular ambient air pressure too quickly, all that extra nitrogen that has been dissolved in their body is going to bubble out of solution and form what are called nitrogen bubbles. So this produces the deep sea diver form of decompression sickness, which is sometimes called the bends. So if we're focusing specifically on altitude DCS symptoms, we can categorize them in two different ways. First, we have the type 1 DCS symptoms, and these are really just inconveniences. These are pain-only symptoms. They are more irritating than anything else, but what they do signify is the early warning signs of decompression sickness, and when these things show up, and hopefully you will learn to recognize these things when they occur, they recognize that, okay, this needs to be addressed. We're at too high of an altitude. We have maybe lost cabin pressurization. We need to descend in altitude so that these symptoms will go away and we get back to a higher air pressure. And then you have the type 2 DCS symptoms. These are called the severe symptoms. These are very critical symptoms, and we'll go through some of them, that signify a medical emergency and an immediate need to descend in altitude and get the affected pilot, crew member, or passenger to a hospital for medical attention. So if we start with the type 1 symptoms, we will start with the bends, which again is caused by nitrogen bubbling out of solution. And usually this is going to affect the joints and muscles of the body. So really what you're talking about here is some pain and discomfort in your muscles and in your joints, maybe some neck stiffness, maybe some pain in your ankles or in your knees. And these tend to increase in severity with altitude and with flight time. And then you have what are called the creeps, which are caused by nitrogen bubbling into the nerves at the surface of the skin. So the most common manifestation of this is called paresthesia, or tingling or kind of a burning sensation on the surface of the skin. The type 2 DCS symptoms, which again are severe and signify a definitive medical emergency, we'll start with the chokes, which is caused by nitrogen bubbling into the lungs. So this is actually going to take up some vital volume space in the lungs, and it's going to make the ventilation process not only painful, but inefficient. So this is going to make breathing very painful and very labored, and as you can imagine, if this continues, this is going to bring hypoxia into the conversation as well, because you're not doing a good job of getting external respiration to occur at that point. Then you have the staggers, which is going to consist of a variety of nervous system disturbances, and this will include all sorts of things like visual field loss, which is called scotoma, aphasia, which is the ability to basically use or understand language or words, disorientation, partial paralysis, muscle weakness, seizures. So these are all things that are associated with our brain and our nervous system's ability to process incoming information and then put out orders and instructions for the rest of your body to do things. So the staggers and the chokes both definitely require immediate descent in altitude and immediate medical attention. So this table from your textbook will actually show you the different types of DCS symptoms. Again, the bends and the creeps are type 1, the chokes and the staggers are type 2. So you can actually see the percentage of incidence that you will see for a person for a 2-hour flight at a variety of different altitudes. So at 28,000 feet, which is kind of the threshold for where you really start to see the beginning of DCS symptoms, almost 3/4 of all cases of DCS are just going to be the bends, maybe a little bit of the creeps. So at this altitude, you will mostly see type 1 DCS symptoms. Type 2 symptoms are going to be a little less common at that point. So 28,000 feet is definitely high up in the atmosphere, and you're going to have very low air pressure there. But that level of low air pressure is going to be severe enough to cause the type 1 symptoms, but not so much the type 2 symptoms unless you've actually got a person with the exact physiological profile that's going to predispose them to the type 2 symptoms. But then if you go to 37,000 feet, which is much higher up and a much lower air pressure up there, you're going to see that the incidence of DCS symptoms actually goes down, or type 1 DCS symptoms goes down, and the prevalence of the type 2 symptoms goes up. Okay, so the increase in altitude is going to increase the severity of the outcomes associated with the lower air pressure and the bubbling and evolving of nitrogen gas. And you will actually notice that you have a huge increase in the incidence of collapse type symptoms. We didn't talk about this on the previous slide, but this is basically the terminal result of type 2 DCS, which involves some kind of loss of consciousness or an incapacitation due to the nitrogen bubbling and evolving, interfering with key physiological processes like circulation of blood or getting that blood to the brain. So that would definitely explain how someone at that point with that severity of DCS symptoms would completely lose consciousness. So let's talk about some predisposing factors for DCS, things that make you more likely to experience some kind of symptom associated with DCS. And what you're going to notice for a lot of these, not only some of them maybe being a little bit obvious, but you will notice that a lot of these are kind of shared in common with some of those for hypoxia. So we'll address those as they come along. And the reason why you're going to see this is because even though hypoxia, which is the lack of oxygen to different parts of the body, and DCS, which is the result of evolved gases coming out of the body, they both may have very different physiological underpinnings, but they are both caused by the same key root issue, the low air pressure at high altitude. Physiologically, they may be caused by different things, but the source of the issue is still the same, that low air pressure at high altitude. So speaking of high altitude, that is the number one predisposing factor for DCS symptoms, and it's like, no duh, right? So DCS symptoms will occur at a cabin altitude of usually about 25,000 feet. That's going to be kind of the threshold for where you really start to see a high incidence of DCS symptoms. You can see it as early as 18,000 feet, and we will see some later predisposing factors that will essentially lower your threshold for when you can start experiencing DCS symptoms, things like your body composition, your age, how much physical activity you undergo, like whether you've deep sea dived at any point in the last day or so. So for a certain person that has no other predisposing factors, 25,000 feet is going to generally be where you start to see symptoms. And this chart here will actually show you on the y-axis the incidence rate of DCS symptoms, and then on the x-axis you have the altitude in thousands of feet. So I said as early as 18,000 feet, but even at 18,000 feet you can see the incidence rate is pretty low. You don't really start to see an inflection point here until about 22,000 feet, and the incident rate goes way up near 100% at that 25,000 feet threshold. So it's worth mentioning that the 193 people that were studied as a part of this study that actually generated the data for this graph, all of the people that were on board the flights that this data was collected from, they were breathing supplemental oxygen over the entire course of a 4-hour flight. So what that tells us definitively, if you didn't believe me from before, that DCS is a completely separate issue from hypoxia. So with this upward shift in the incidence of DCS symptoms here, what you're seeing is that a lot of the people on board these flights are experiencing the symptoms and effects of decompression sickness, even though they are receiving enough oxygen. So it's not hypoxia that they are experiencing, it is something completely different, which is decompression sickness. Our next predisposing factor is the rate of ascent. So we mentioned that excess nitrogen is eliminated through the lungs. We saw this with deep sea divers. We saw that deep sea divers get the bends most severely when they come to the surface too quickly, so they have to be careful about climbing back to the surface of the water at a reasonable rate to give their lungs time to eliminate some of that excess nitrogen that's bubbling out of solution. So you're going to see something similar but kind of opposite here with a climb to altitude. A rapid climb to altitude will actually cause nitrogen to evolve more quickly, giving less time for the elimination of that gas through the lungs. The amount of time you spend at a particular altitude above 25,000 feet is also going to matter very much as well, so those symptoms will increase in severity with your exposure time. And then something similar to what we saw with hypoxia, which is that physical activity is also a predisposing factor. With hypoxia, increased physical fitness and activity increases your body's demand for oxygen, so it makes your hypoxia symptoms all the more severe when they occur because your body just naturally requires more oxygen. In this case, it's a slightly different issue. Physical activity will actually increase the rate of gas exchange and quicken the flow of blood throughout your body, which makes the evolving of gases occur more quickly with gains in altitude. So kind of the same thing that we saw with predisposing factors number 2 and number 3, except this time with some kind of physiological underpinning. So heavy exercise will raise your physiological altitude by thousands of feet and make DCS more likely. So we saw that graph before that said that DCS symptoms can show up as early as 18,000 feet, and this is one of those predisposing factors that makes something happening that early much more likely. We also have body type, so your body mass index, for example, whether you're heavy or skinny or whatever. It turns out that most of your soluble nitrogen is stored in body fat, so those with a higher body fat percentage and a higher body mass index are much more likely to experience DCS symptoms because they have a greater amount of nitrogen stored up in their body that can potentially bubble out of solution at those low air pressures. Age is also a predisposing factor, so increasing age will increase the likelihood of developing DCS symptoms several-fold. Your frequency of exposure, so how frequently you go up at high altitude without cabin pressurization, is going to make a difference. And then finally, scuba diving is going to make a huge difference. Those who have recently scuba dived are much more likely to experience DCS symptoms due to the increased levels of soluble nitrogen in their body. So it takes a while for that excess nitrogen to be efficiently eliminated through the lungs. And the FAA actually recommends that anybody who has recently scuba dived wait at least 24 hours before boarding a flight to allow for enough time to rid the body of that excess soluble nitrogen. Okay, so up until this point, we have talked about the process of gas evolution, which is the bubbling of gases that were previously soluble in a liquid, bubbling out of solution because of low air pressure. So they basically form gas bubbles, and those molecules escape the liquid state and they go into the gaseous state. So that causes all sorts of problems with decompression sickness. So now we're going to start talking about the idea of evolved gases versus something new, which is trapped gases in the body. So again, when we're discussing evolved gases, we really just mean that gases that are soluble in body fluids that become less soluble due to the lower pressure and they evolve out of solution. So this was described by Henry's law. So with trapped gases, what we're really referring to are gases that actually naturally occupy different body cavities like your thoracic cavity, the different sinuses around your nasal cavity, and then even your teeth and your GI tract. So these trapped gases are actually not going to be that interesting with respect to Henry's law, but they are going to be dictated and governed by Boyle's law, which we saw in the previous chapter. If you've forgotten what Boyle's law states, it states that a climb to altitude will cause the total air pressure to decrease, and that means that the volume of those trapped gases is going to expand. Boyle's law says there is an inverse relationship between the volume of a gas and the pressure that it is under. So if we climb to altitude and the pressure on the gas decreases, that means any gas that is trapped in our body is going to expand outward and take up a greater volume of space. So we've seen before that obviously an important fundamental of atmospheric science is that gains in altitude are accompanied by logarithmic drops in total air pressure. So you can see with this diagram here that at sea level and at 1 atmosphere of pressure, at 1 atmosphere of pressure, that's going to be what you find at sea level. So about right over here. So at sea level, you have about 14.7 pounds per square inch, which is equal to about 760 millimeters mercury. But as you gain in altitude, you get this logarithmic drop in air pressure with those gains in altitude. So we know that for sure. But essentially what the graph is saying here is that the total air pressure at an altitude of 40,000 feet is going to be a little less than 3. So that is nearly 7 times less than what we find at sea level. So yeah, that's kind of a big deal. So what that really means is that if the ambient air pressure around you drops by a factor of nearly 7, the trapped gases in your body are going to expand by nearly a factor of 7, specifically closer to a factor of about 6. So the increased volume of these gases in your body cavities is going to cause some problems, mostly discomfort. They can become serious medical emergencies, but mostly it's going to just be kind of a pain in the rear as you're flying at different altitudes. And the problem here is that you have these gases expanding in volume, and it's going to cause discomfort because a lot of them have no real means of escaping. So you basically just have to wait or take some other measures to make sure that those gases either have some way of escaping, or you have to wait until you get back to ground level and you wait for those gases to contract back to their normal volume when the air pressure goes back up. So we're going to see here that the body cavities that are most affected are going to be the middle ear, the sinuses, the GI tract, and oddly enough, your teeth. So we'll start with the ear. The ear, which is something that we are going to basically have a whole chapter or two dedicated to later on, so I'm not going to go into too much detail here. We'll talk about how hearing and equilibrium are governed by different organs that are in the inner ear at a later point. But the ear for now can be divided into an outer ear, which is on the out here, no pun intended. The outer ear is this part out here, the middle ear is this cavity that you see right here. That's going to be kind of our pain point here. And then the inner ear consists of these sensory organs here called the cochlea, which we're going to see helps us to hear. And then the vestibular apparatus and semicircular canals up here, which are going to help us with balance and equilibrium. So we're going to focus on the middle ear here. The middle ear occupies the space here in between your eardrum or tympanic membrane and then these sensory organs that you see over here. So because this is a hollow cavity, it contains a certain amount of built up air that can change in volume depending on what your ambient air pressure is. So when that happens, the barotrauma, or the trauma that's associated with changes in air pressure, that is associated with trapped air in the middle ear cavity, that is called barotitis media. So again, the middle ear consists of the space in between the tympanic membrane, which is more commonly called your eardrum here. So again, we'll see later on in the semester that the way hearing works is that your outer ear funnels in vibrations in the air. Those vibrations will strike the eardrum and it will start vibrating at a given frequency. And then those vibrations will be passed through the auditory ossicles, these tiny little bones here. And then those vibrations will cause fluid to move in the cochlea and in the semicircular canals. And that will stimulate hair-like cells that actually help us to stimulate nervous messages that go to the brain to allow us to interpret the things that we're hearing and things like that. So that's not super important for right now. What's important is this middle ear fills up with air, and that air is subject to what we saw with Boyle's law. Now, thankfully, we do have a mechanism for equalizing the air pressure that is caught up in the middle ear. You have what are called eustachian tubes, which connect the middle ear to the throat and provide a mechanism for equalizing air pressure. But the issue here is that these tubes are very narrow and they are definitely prone to swelling if you're sick or if you have an infection, and they can get blocked with things like mucus very easily as well. So it is not a foolproof method for equalizing air pressure between the middle ear and what is outside the body. So when altitude is gained, we're going to see that the ear, the middle ear specifically, is differentially affected based on whether you are climbing to altitude or whether you are descending from altitude. So when altitude is gained and total air pressure decreases, this will cause the volume of trapped gases in the middle ear to expand. So you're going to have all this air trying to take up extra space in the middle ear, and that actually is going to cause the pressure inside to go up because that air doesn't really have the operating room to be able to expand the way that it wants. So that would cause some discomfort, all that extra air that's taking up extra space in the middle ear. So this expansion will actually cause the air in the middle ear to push outward on the eardrum. Okay, so that's going to push outward on the eardrum. And basically, that's going to cause a little bit of pressure there. And that is actually going to push that extra air through the open eustachian tubes, and that the escape of air from the middle ear will cause that eardrum to snap back into place, which produces kind of the familiar popping sensation that you experience when you climb to altitude in an airplane. So that popping sound is just your eardrum snapping back into place after air escapes the middle ear through the eustachian tubes. Now, unfortunately, this pressure equalization mechanism doesn't really work all that well when you're descending from altitude. And the reason for that is because the air in the middle ear this time when you start to build the pressure back up outside the body when you descend from altitude, that air in the middle ear is going to contract, which is going to act kind of like a vacuum that's going to pull the eardrum inward. So the solution here to get the eardrum back into its correct configuration should be for air to enter the middle ear through the eustachian tubes. But the issue is that the eustachian tubes are kind of like one-way valves. Air exits the middle ear pretty well, but air doesn't enter all that well. So really, this is going to cause some discomfort as your eardrum is kind of contracted inward. It's going to mess with your ability to hear, and you're just going to kind of have this uncomfortable feeling like something is going on with the space inside your middle ear. Now, a common solution to this is to perform what's called the Valsalva maneuver. So even if you didn't know exactly what this is called, you've probably been encouraged to do it before. It involves using your hand and pinching your nose and then breathing outward without letting any air escape your mouth. So when you do that, you can kind of feel the sensation of your eardrum trying to pop back into place. So this can actually be a mechanism for trying to force air into the eustachian tubes to clear out that ear block and get your eardrum back into the correct configuration. But even with this maneuver, that can be difficult if your eustachian tubes are swollen shut due to allergies or a cold or a viral infection. So pressure equalization, so that kind of wraps up our discussion on the middle ear. We're also going to find that we have issues with our sinuses as well. So these are hollow cavities within our body, within our skull, that do and can fill up with air. So pressure equalization in the nasal and paranasal sinuses, which you see illustrated here, usually that's not too much of a problem because there actually are direct and open pathways to the outside via the nasal cavity. But obviously, everybody's kind of had sinus infections before. If you have some kind of an infection or a cold or something else, then swelling of the sinus openings can cause pressure equalization to not happen, and the discomfort that is caused by pressure building up in the sinuses is called barosinusitis. And now a really interesting one is tooth block. A lot of people complain when they climb to altitude of their teeth hurting. So if a person has a dental cavity that hasn't been filled or has recently had a dental procedure done like a cavity being filled, it is very likely that gases can become trapped in the teeth in those hollow cavities or inside the filling, and then can build up on ascent to altitude, and that can cause some pain in the teeth. So the associated nerve discomfort is called barodontalgia, but it could also, as your textbook points out, just not exactly be an issue with the teeth themselves, but referred pain from the barosinusitis. So without getting into all the medical physiology here, referred pain refers to a part of your body hurting because of a nerve issue that actually has the source of the problem occurring somewhere else in your body. So it would be like your, like you've probably heard of people like having heart attacks, complaining of their left arm hurting or their left arm kind of tingling. A lot of that is what is called referred pain. It doesn't mean that there's something wrong with their left arm. It's actually referred pain coming from their heart, which is nearby. So that's what we mean by referred pain. Just because your teeth hurt, that doesn't mean there's something wrong with your teeth. It could just be kind of a side effect of what's going on with your nearby sinuses around your nose. Okay, and then your GI tract, oddly enough, can also fill up with gases as well. I mean, everybody farts, right? So you at least understand that gases build up in your small and large intestines, right? So what is going to affect things here is what you choose to eat and or drink right before you get on the airplane. This is going to impact your degree of discomfort following ascent to altitude. So we're definitely talking about things like carbonated beverages. That's like just asking for trouble, basically begging for all these gases to bubble up in your intestines and then expand in volume once you get up to altitude. Gas-forming foods like onions and things like that, high-fat foods. These are all asking for digestive system issues and discomfort once you actually get up to altitude, and that is because the expansion of those gases once you actually do get up to that altitude. So that leads us to the last thing that we're going to discuss here. How do you manage your evolved or trapped gas problems? So number one, avoid flight at high altitude without cabin pressurization. The FAA actually has strict guidelines that dictate how long you and how often you can be at high altitude without cabin pressurization. But if you're at all worried about DCS, definitely good to have a pressurized cabin. That way, you not only don't have to worry about hypoxia, but you shouldn't have to worry about the most severe symptoms of DCS either. Definitely avoid scuba diving before your flight for the reasons that we mentioned before. And then another thing that we haven't mentioned yet is a prophylactic denitrogenation, or what is sometimes called pre-oxygenation. So this is not so common in aircraft that are naturally pressurized. This is going to be a more common procedure in military flight operations compared to things you see with civil aviation. Basically, the idea here is that it involves eliminating excess nitrogen in the body by pre-breathing 100% oxygen before you even get on the airplane. So this is highly effective the first 30 minutes that you breathe oxygen. The idea is that, as we said, you eliminate excess nitrogen through your lungs. So if you're breathing 100% oxygen, you are eliminating nitrogen without introducing new nitrogen into your body. So again, this is highly effective at stymieing the effects of DCS because you are getting rid of that pesky nitrogen out of your body. But the data actually show on the next slide that you kind of get diminishing returns on this after about the first 30 minutes. So your pre-oxygenation time will, like how long you're breathing that 100% oxygen, will actually decrease your incidence of decompression sickness symptoms, but you can see the longer you breathe the oxygen, the less benefit that you really get there. So something interesting to consider, and it definitely makes sense given the science of all the bubbling of evolved gases that we talked about. If you get rid of a lot of the nitrogen that's built up in your body, you remove a lot of kind of the source issue of what's causing your DCS symptoms to begin with. Okay, that's going to do it for this chapter. As always, I thank you for your attention, and I will see you next time. So long.